Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
John Buchanan about the transplant patient?
I do. Let me see if I can pull it up for you.
Yeah, thought that's probably the newest thing that's and still controversial because we don't really know what it means. But they're talking about the fact that when you do give transplant patients who are immunosuppressed the vaccine, the antibody titers are lower than expected. And so the question is the antibody response sufficient? And actually, the truth of the matter is that we do not know because antibodies is one way of responding, but we also have T cells and other B cells that respond, that give you the immunity. But it's food for thought that maybe transplant patient may need more than the traditional vaccines because they are on immunosuppressant medications, which means that they aren't going to respond as well as everybody else. So that's food for thought.
Yeah, no, it starts right now. Matter of fact, it's on right now.
Yeah. So anyway, it's interesting to think about. Now they have done studies on a small number of patients. So they said only 17% produced antibodies. There were 436 transplant recipients. And this is, of course, the only problem with some of this is that this was after first dose. And then later on, the question is what happens after the second dose. And so studies are being done to get an answer to that.
No. No, you just called me.
But it is important to recognize that it's not only the antibodies that give you the immunity. It's a major part of it. But there are also T cells and other components that give you the immunity. But a big part of it, of course, is the antibody production. So we'll await further studies to get an answer to the question as to whether or not transplant recipients will need additional protection. Who knows? They may need a third dose, or they may need nothing. Only studies after they receive the second dose, because remember that booster dose or the second dose is what. Although there are recent studies which we'll go into later that demonstrate that after the first dose, recent studies suggest that 80% of the people who received the first dose had antibodies, and after the second dose, it was over 90%. And some instances close to 100%. So,
Is there anything? Is there anything that can?
Yes, sir?
Is there anything that can stimulate T cells?
Well, this test doesn't measure it, but it is expected that the antibody also trigger the T cells to respond as well. So the question is the meager antibody response sufficient? And I think only time will tell. Yeah.
Oh, Dr. Callender,
Yes.
for transplant patients, the issue is, most people get 60% efficacy, with the first dose and then 90% with the second dose. So after they do these studies on transplant patients, it seems that maybe they are saying, I'm not definitely saying that they're saying this, but with the first dose on transplant patients, it may be 50% for the first dose and only 75% or 80% for the second dose.
Well, it says that only 17% produce antibodies after the first dose. So that's
Wow.
17%. So that's way down. And it may well be that after the second dose, it was substantially higher, but I guess we have to wait and see.
Dr. Callender, is this a dumb question? Do they know why this happens?
No. Oh, well, we know why, because they're on immunosuppression. They're on prednisone.
Oh,
Oh,
okay.
They're on prednisone. They're on Prograf. They're on many immunosuppressive medications. So that's the reason. Yeah, and that's why. And remember, the initial studies were not done on transplant patients, so there's no evidence. So that these are the first studies that done on transplant patients, and this is only after the first dose. So we're going to need to get studies after the second dose to see whether the booster dose gets it up to a respectable level or not, because it may well mean that in transplant patients you may need an additional dose, or it may not. So we just have to wait. But the preliminary evidence suggests that it's different in immunosuppressed patients.
Dr. Callender, those who did not have transplant, those are if they're not immunocompromised, what is the first? How much you get when you get the vaccine? The first, the first with the first.
80%. 80%. 80% for the most recent studies say that you get 80% protection for the first dose and 90 to 100% protection for the second dose.
Oh.
Dr. Callender, the other thing to point out is that even patients who are immunosuppressed and people who are not, they all can get from last week, we found out that they all can get COVID again.
Oh.
Well, we don't really have any evidence, and we think that the antibody protection, we don't know how long it lasts. The only way we would know is by doing studies on those patients who received the vaccine for a year or so, which is not the case. Nobody's had it that long. So we don't know the answer to that question. And only time will tell. And that's one of the things about this new disease entity and these vaccines, is that the only way we'll know is after a year or so, we'll do antibody tests and find out. But we don't really know how long the vaccines will protect. As you know, with the flu vaccine, we have to get a vaccine every year.
Yeah.
So it may well be that we'll need the same thing with this vaccine, but we don't know yet, because we don't have enough patients who've been vaccinated longer than a year. And some would argue that it's unfortunate that they did it after the first dose. They could have waited and done it after both doses, because this is although this is interesting finding, because it tells you that it doesn't work as well in those patients who are immunosuppressed. And so and that's the one thing about transplant patients, things are different.
Dr. Callender, now how about that only one vaccine you get from Johnson and Johnson? How will that affect the?
We don't know, because they didn't do that. They didn't test that.
Oh, okay.
They only did the Moderna and Pfizer, right? And this is another article that talks about what you were asking that one dose is effective, but the booster dose takes you to the top. And one of the things they did is they did these tests on people who frontline workers. And this is different from the clinical trials. This is the actual, as you know now, we've had more than 1 million people vaccinated. So they now are looking at those people and deciding what happens. And they're discovering that you're 80% protected after 1 dose and 90% effective after 2 doses. So how this will measure up with the transplant patients remains to be seen. It's interesting that in many ways the vaccine is better than we thought it was. And it's among the most efficient vaccines that we've ever had. Measles was the top.
Dr. Callender, it's still not 100% that you can't get the coronavirus.
What it does say is that you've got good idea that if you get it, just like with the flu vaccine, you won't need to be hospitalized or die. That's what it's.
Okay.
But you're right, though. It's not 100% of eliminating the disease, but it just about guarantees that you will not be hospitalized or die from it, from the disease, just like with the flu.
Mm-hmm.
So, Dr. Callender, with the perspective of having a vaccine every year, that's going to change because of all the variants. They're going to have to cover those. We're looking at like probably, you know, getting your flu every year, your COVID every year. You know,
Right.
I think that's going to be part of what we have to do.
May well be. May well be. Time will tell, because when we do the tests on people a year after the vaccine, we'll be able to see what kind of antibody titers they have. And if they're low, we'll know. We have to give a second a dose every year, just as you had suggested.
Dr. Callender, we're going to have to add this to our Stevenson app.
We may have to, right?
True that.
That's one thing about information, it changes. So we have to, you're right, we have to modify that. We may have to wait and see. It looks that way.
Yeah, since these vaccines are probably going to be an annual affair, the vaccine card is probably going to look like a passport with Visa stamped in the back.
Yeah, well, yeah. Well, I think some of this is addressed in this article that hey, Chris.
Hey, what's going on? How you doing?
Good. So go on, scroll down, John. I think you still need to wear a mask. I think that's one of the 10 things, which we know already. Until we have herd immunity, keep going. You can still catch it, just as you were just asked about.
All right. Okay. I'll talk to you.
It anticipated the question that you asked. Prevents you from dying and up in the hospital. Theoretically, there's a chance you can infect somebody else and not even realize that they asymptomatic spreaders, but we don't know the answer to that. This is one thing that helps the grandmas and others. You can visit friends and family, especially if you're fully vaccinated without wearing masks. Physical distancing. However, if you're spending a lot of time with unvaccinated people, it's in their best interest to still wear masks. But the hugging thing is something that you can now do, which you couldn't do before. And you see pictures nowadays of, in the post, you have the grandmas hugging their grandkids. And if you're exposed, you don't have to quarantine after exposure. If you get symptoms, though, you should test it. And this item 6 is important because anybody who decides they're going to leave the country, which is not a great idea right now, you need to have proof of vaccination. They're going to test you anyway, but you need to take that with you.
Yeah, well,
Doc, okay, is there for some reason I heard about an app that you could have on your phone that has your CDC card on there?
well, it's
Well,
not,
they say you can take a photo and store it on
Take
your
a
phone.
picture.
yeah, the app is your Photos app.
Yeah,
So
Yeah, take a picture of your card.
yeah,
right.
you can back it up by emailing the picture, and so you have it in 2 places: the app and in your email.
Well, I actually thought that maybe CDC would actually develop an app for everybody that they could because it's, you know, this is a CDC card, you know, that we have. Maybe they can make that electronic, send that out as an app.
Well, they haven't done it yet, so we'll have to wait.
And you're getting techie. You're getting techie.
Yeah, the central data for all the
And
vaccines.
you see that number 7, travel is still discouraged. Although it's not for the reason that some think. It's not that you're worried about getting the virus. It's your, wherever you go, things are different and requirements are different. And then after you get there, you have to come back. And then wherever you've gone may have different requirements. So traveling outside of the country is not a great idea at this time. Inside the country is not that bad, but going outside of the country is dangerous as far as I'm concerned. It's discouraged and it's dangerous because you may have trouble coming back.
Speaking of that, Dr. Callender, as a scuba diver, you know, I've been shut down for over a year from travel. But some of these countries, like in the Caribbean, they demand that you have even if you have a vaccination, you have to have a test.
Yeah.
They want you to have a test within 3 days of travel. In order to return to the United States, the same thing. You have to have a negative test within 3 days. If you test positive, you're stuck wherever you are. You cannot return.
Right.
Some of the hotels are now saying, if you come and stay with us, we'll put you up for 10 days. You know, till the what is that? The infectious period. The quarantine period, right. And then you could come back. Isn't that crazy though? You get somewhere, you have to stay there.
Yeah, so that's why they say travel is still discouraged. International travel is unwise.
I just heard that Delta was the last airline that saved that middle seat, you know, and now as of May 1st, they are not reserving that middle seat as a precaution on the airplane.
They must be the only one because all the others are just they filling up those planes as much as they can.
Mm-hmm.
I say it's a good time to go to the doctor, dentist, and get your colonoscopy and dental cleaning or endoscopy, as John talking about. And it's interesting. It's common about mammograms that false mammogram reading may occur as a consequence. So they suggest waiting 4 to 6 weeks after you're fully vaccinated. And the need for a booster shot, we were just talking about that. How soon you'll need it remains to be seen. This is what really is the biggest problem, the herd immunity. That's what's required for us to return to normal. It's to me, it's unlikely that it'll occur this year, but if it occurs this year, it'll be late. Now, of course, it says here it ranges from this summer to early 2022. Yeah, I'm optimistic about late fall or early 2022. I don't know. If everyone is vaccinated by June, then the fall may well be the time. There's an article later on that talks about how many people are being vaccinated and how many aren't. This is an interesting article on how diet may help reduce the risk of severe illness, and talks about why obesity is one of the biggest problems. Many people don't realize that obesity is characterized with low-grade chronic inflammation. And it's a stress immune response that most people aren't aware of, but it is. And that's why obesity was the cause of COVID and the COVID deaths. It says 78% of people who are hospitalized or died as a result of obesity.
There could be some other articles that explain it a little more, but my takeaway was that the adipose cells, which are fat cells, triggers cytokines and histamines that are the inflammation. How do the cytokines and histamines react on the body?
Well, when you have an antigen antibody response, there's release of cytokines, and these produce an inflammatory response. And this inflammatory response is what triggers the release of products that cause people to die. So if you're obese and you have a lot of these inflammatory cells around, this makes it more likely that you'll have this inflammatory process, which is what kills people with COVID.
Dr. Callender, on my computer, I have something, Adobe Flash Player. Is that what's that you're talking about?
I don't know what you mean by Flash Player.
I don't know. It's on the computer, that screen. It says ADOBE Flash Player.
Okay, well, just take that off. Get rid of it.
Oh, I don't know how to do that. I have to take it down to my husband. He's going to have to fix it. So that's not on that screen, right?
No.
No.
Okay, let me take it down to you.
That's on your computer.
Yeah, minimize it.
Remember, I'm not supposed to touch the computer. My husband, he told me not to touch the computer.
Listen to your husband.
Yeah,
Okay.
I'm giving it to him. I'm obedient wife.
You hear that, Carol?
I'm trying to make it in. It's hard.
Oh, Lord have mercy.
Anyway, that's the mechanism, and we actually did in our research. We identified those cytokines, a number of them that are increased in people who are overweight. And it's that inflammatory response that triggers deaths in COVID.
One of the earlier sessions, we were saying that diabetes is a reaction to inflammation. So would the cytokines trigger diabetes potentially?
Well, actually, there's a recent paper that just came out that indicated that type 1 and type 2 diabetes are both put you at greater risk for death with COVID. And there is some suggestion that the inflammatory response, if you didn't have diabetes, can in some people trigger diabetes. But for the most part, if you have diabetes, the likelihood of hospitalization or death is greater if you have type 1 or type 2 diabetes.
Dr. Callender, is there any data that suggests that one of the vaccines is better than the other for diabetics or anybody with autoimmune disease?
I don't know any information that answers your question.
Okay.
Yeah, that'd be that's an interesting question to answer, but I don't know the answer to that.
Oh, I can't.
This is his goal of 200 million, although we've got to get up to close to 300 million to have herd immunity. It's a lofty goal because he wants that by April 30th, which would be wonderful. I think he could conceivably pass it, but this is the goal. We want to have about 80% of the country's population vaccinated. We need to have about 280 million people vaccinated before we have herd immunity. Although there's some data that suggests the figure may be 70% rather than 80%. Anyway. Now this is an article that makes you wonder about some of the governors across this country, because they're talking about eliminating necessity for masks and other irresponsible ideas, which are premature. And the CDC has said that this is likely to trigger a fourth wave of the virus. But there's some governors who have taken off the mandatory nature of masks. It's amazing how we cling to independence as something that is so desirable that we would risk our lives for it. And then there's another article that talks about the Democrats versus the Republicans in terms of getting vaccines and also wearing masks.
This is the other article, I think.
Yeah, this is it.
Darryl
Yeah,
talked about.
because you know, when people who are obese and especially morbid obese, it's not just, you don't push a button and suddenly become not obese. It takes a while, and so how do you get people to stop eating and eating like they've been eating like that for decades? And so it's more than a notion to address people with BMIs over 40. Is where you talk about morbid obesity. And as you can see, people have been working on it, but our diet is, the American diet is so unhealthy, as Darryl has talked about ad nauseum, that it's not easy. It's easy to talk about it. It's less easy to get it, to tackle it and get it done. However, it does require a new obesity strategy.
So, Dr. Callender, we have a new term, COVID weight.
Oh, that's true. And that's another point, that the isolation process has caused a lot of people to exercise less, eat more, and therefore they gain weight. So, which is just the antithesis of what you want to happen.
Yeah, well, I like to add, we got American diet, but it's American lifestyle. American lifestyle and culture. This is damaging diet. For example, in most parts of the world, you go to the grocery every day and you walk to the grocery. You don't drive a car. And so in most parts of the world, in order to eat, you have daily activity. And you're walking for probably, at least an hour, several hours. But Americans go forever without daily activity. And that daily activity is a great combatant to obesity. And then the other thing is a culture attitude towards overweight is very generous in America. For example, in China, it's people are looked down on being overweight in China. In many parts of the world, there's a stigma attached, whereas there's minimal stigma attached in America.
Yeah, good point. Good points.
Dr. Callender, you know that I've seen lately that people are into having weight loss surgery more now, because it used to be it had to have certain health conditions and things like that, but now it's just like you just have to be overweight. You go see a doctor, you say I can't lose the weight and I want surgeries, some things you have to go through. But I've seen now a lot more people having weight loss.
Yeah,
Obesity has become an industry in this country. It's an
big one.
economic industry. Yep.
Very big one. This is an article that I didn't foresee coming, in which it talks about Black Americans are now being vaccinated, which is good news. It rose from 41% in February to over 55%. And now what is really striking is the fact that Blacks have deaths twice as often as whites, and Latino Hispanics have deaths twice as much as Blacks. So it's amazing how it has affected the Latino Hispanic population even more than the African American population, and it's affected the younger Latino Hispanic population more than it affected the older population.
Dr. Callender, I was, for some reason, this was muted when you were talking about the, obesity in America. I just wanted to make a statement, what Darrell said. He was so right. And Americans give fancy names to people, to obesity and all that. In other countries like England and all that, they say, fat, and they come out and tell the truth. In India, they say, you're very fat. You have to lose weight. Yeah, but here they give what for overweight, the ladies' clothes, something they say, I forgot what it is, from 18, size 18 and up,
Plus,
and plus, yeah, obese and all that. They don't come out and tell the truth that you're very fat.
Okay.
No,
serious.
I don't think they'll be able to sell it.
For Maya to tell them what's up.
No, girl, I agree with you. They use fancy words in this country.
We gotta survive.
So, I have a question for Carol. Being in the classroom with kids, you see a lot of overweight kids too these days, right?
Yeah, because they can't go outside and play. They're latchkey kids with their environment, and they got all these devices to stay home and sit and play on their devices. They've taken a recess away from the elementary schools.
Yeah.
So consequently, and kids are bused to school. They no longer walk to school.
I know.
So our whole society is predicated upon getting larger children and larger adults. Just our way of living. It's a hard thing, and this COVID hasn't helped because you got to stay inside to keep from getting the dreaded disease and walking and everything. And if you want to eat, the nearest grocery store is a mile or 2 miles or 5 miles away from where you live. So you're gonna you want to get in your car and drive to get your groceries.
Chicken called
It's their
DoorDash.
diet as well. It's their diet as well. I mean, a lot of prepared foods, that kind of thing, a lot of snacks, unhealthy snacks that kids are eating. And we're seeing a real increase in type 2 diabetes in young children now,
Yeah.
as well as hypertension, which
Yeah,
has a lot of implications for future transplants.
right.
And grandparents like me who leave cookie jars around, we don't help
Whoa.
and
Right.
give candy to our babies because I was trained that way.
Yep.
I've just been brainwashed and trained, and I love the candy and stuff myself. So it's very, very hard.
I agree.
Well, you need
Okay.
me as a food police.
Yep.
And that's what I go
That's
to
true.
my brother. I call him whenever I get tempted.
You get too many people arrested.
I put everybody in jail.
And Dolores was talking about people getting the surgery for obesity. They have to sign a waiver, but most of them, they don't realize that once you get that surgery, you can go back to your eating habits and be normal than you were
That's
before
right.
you even started.
Yeah,
It's
you're right,
interesting.
Carol.
Just
You're
a
right.
little picture.
It's interesting also that the bariatric surgery can also cure diabetes.
Mhm. Mhm.
Somebody's
It
making a lot of
didn't, it
noise in
didn't
the
cure
background.
mine. It didn't cure mine.
What did you say?
I said it didn't cure mine.
Yeah, you're right. And but it does, I'd say about more than 50%, more like 70% of the people who had obesity surgery, their diabetes goes away. And for many more than, I think there was an article recently that talked about 10 years or so.
One of the things that's helping me out a lot, and I think I have mentioned it before, is the Fitbit. It motivates me to want to get up and walk.
Right.
To keep
Yeah.
the track of how many
Mhm.
steps I make a day.
Yeah.
And here recently, I've been tuning into my sleep pattern, which is another thing that helps you with your weight. It is just a motivator. It's worth its weight in gold, especially for me. Since I've been wearing it, I know I have dropped 10 pounds.
Oh.
And I don't always go outside to walk. I walk within the house, or I'll do things within the house to increase the number of steps that I take. So I highly, highly recommend the Fitbit because it has many, many advantages to good health.
Okay. Good
Dr.
advice.
Callender, someone is making noise in the background, is interfering with our
Maybe you go on mute.
recording.
They can go on mute
Yeah,
until
okay.
they.
Good.
Okay, now this is getting a quick turnaround test for COVID. Of course, nowadays you can get COVID results in hours, but this way you can do it at home. And I think you can see the price there also as well. And he also has a saliva test as well as a nasal swab. And so I think this is of greatest merit to those who are not vaccinated. And we still have a significant number of people in the District of Columbia that still are not vaccinated. There's a recent concern brought by people at George Washington University Hospital because they were told they could get their vaccination, but the DC allowed them only to vaccinate people from DC. If they were from Maryland or Virginia, they would refuse to vaccinate them. So you still have a significant number of people who are not being vaccinated who want to be vaccinated. Is there still anybody here who has not been vaccinated?
I get my second shot today at 11:15.
Oh, good.
Congratulations.
Congratulations.
Yay.
Wonderful. Hey.
This is Cheryl. I get my second shot on April the 6th.
All
Good,
right.
good.
Congratulations.
Thank you.
April the
This is Ro-
13th for me.
This is Rochelle.
Congratulations.
This is
Congratulations.
Rochelle. I've had both my shots.
Good, good, good.
Wonderful.
It's
Wonderful.
amazing how things have changed from when we first started talking about it. So now everybody wants to get it, and I think that's wonderful. I know for our MOTEP conversation, we say, love yourself, take care of yourself, get the COVID vaccine. So we incorporate that because I think it's important. Somebody needs to go on mute. I don't know who it is.
I don't know. Yeah.
Not
Somebody's
me.
making a lot of background
A lot of
noise.
It sounds like a
Almost sounds like
printer.
Well, that got it.
Yeah, they got it.
Now this is
Oh, it's bad.
this is interesting battle that still exists about where did the virus come from. Not sure that it matters because it's here and we got to deal with it.
Does everybody know how to unmute? Does everybody know how to unmute?
Unmute?
Yes.
Okay.
I do, yeah. I'm sorry.
Okay, well, I'm going to mute everybody.
You
and
did.
Now you unmute as you need to.
Well, you know, the reason this becomes an issue is because Donald Trump's calling it the Kung flu may have contributed. I don't know whether it did or not, but it may have contributed to Asian Americans being attacked. Whether that's true or not, I don't know, but a lot of people know that his comments were deemed inflammatory.
And the attacks are getting worse. It's serious now. Yeah, scary.
Yeah, it is. It is. Yeah.
Yeah.
It's interesting that many people are viewing China with great hostility. Actually, China's been buying up America for a long time, so it's not new. But what actually was made it worse was that the Redfield implied that it came from a laboratory in China.
Right.
And as a matter of fact, somebody wanted to sue China for the COVID virus. So anyway, that's something that we'll hear more about more. And this is just an article which is emphasizing what we've been talking about for most of this program, how adult obesity is increasing and its negative impact upon people who have COVID.
It's interesting to look at the where the greatest incidence, the prevalence is, and it's mostly red states.
Right. Right.
Which I think is starting to turn the corner on who's dying more now too. We're seeing more non people of color who are dying from this disease.
That's a very interesting fact because now they're not even talking about that. You hear very little about that. If
well, because the data is so convincing. You look at the data for Hispanic adults and non-Hispanic, and then you look at the white. So it's when you look at the data, it's actually frightening when you look at the blacks and the Hispanic mortality rates. And I'm hopeful that much that will change if we get vaccinated. So, because it's doubtful that we're going to suddenly not be obese.
But a lot of them are obese in the red states, especially in the South.
That's right. So they need to get vaccinated. Right.
Mhm. As a matter of fact, I just came from Georgia, and the farther south we drove, the larger people were. No, really, I'm serious. I mean, I'm not being, facetious, but that's really true.
Yeah.
And if you look at the health data, it shows that obesity is much more prevalent in the South than it is other places.
Now, some people, I think you mentioned earlier, Joyce, that about insufficient sleep is linked to depression, which also is linked to overeating. And so getting enough sleep is important as well. We all know how stress is, and I think Reverend Gaddy had pointed out how stress is involved with all of it. This is the relatively new data that the vaccine is 100% effective in children aged 12 to 15, because they had just finished their test, paving the way for them to use it in children. Because remember, you have to be over 16 right now to get the vaccine, and this will pave the way to give it to children.
Dr. Callender, let me ask you a question. We have twins in our family who are now 2 years old. We have all been vaccinated with at least one of the shots. How should we interact with the 2-year-olds? Should we keep our mask on? Can we hug them without our mask on?
When you're fully vaccinated, you could.
Okay.
And there's also data on the people who are disabled. That people who are disabled are also in the same category as people who are obese. And so I remember you were talking about your niece, I think it was, who is disabled to some extent. And the data is that they need to be vaccinated just as well as those people who are obese.
And I am happy to say that Shelby has received her first shot and is due to get her second shot, I believe, this week or next week.
Wonderful, good. I was concerned about that.
Yes, yeah. that was a requirement.
Good.
And Dr. Callender, when you say fully vaccinated, would that mean the second shot plus
yes.
2 weeks after?
Yes, that's what that means. Although, even though the most recent data is suggesting that after the first shot, 80%, it was 80% effective, but certainly after 2 weeks after the second shot, yeah. It's interesting that just about all schools require testing, but now they're going to talk about requiring vaccinations to come back to school, which is a good idea. Good idea.
I heard the president of Rutgers. He said he's already gotten some kickback against vaccination. He said he doesn't care. So if you're coming back to Rutgers, you must be vaccinated, unless there are a few extenuating circumstances, like religious. Some religions don't allow that, or for some reason, or some kind of physical problem that would keep you from getting vaccinated. But otherwise, everybody has to be vaccinated to come back to Rutgers.
I think it's a good rule, and as you said, except you have exceptions to every rule, and those exceptions are reasonable. I wonder how many other universities or colleges will follow that example.
Like Notre Dame.
Yeah.
I hope so. Yeah, our reunion, our class reunion is canceled for 70 and 71, our 50th reunion because of COVID.
Wow, that's saying a lot. That 50-year reunion brings in a lot of dough.
Yeah, it does.
Yeah. That's amazing. They held the vice principal. Why not the principal? That's interesting that they would hold the vice principal accountable. Oh, because he didn't report information. Okay. Wow. There's dinner dances and everything keep going on. Yeah. Well,
you see where they are though.
Yeah. Yeah. And there's an article about that too coming up. You know, last week we talked about the fact that the District of Columbia had the lowest incidence per capita of people being vaccinated. And I think that may have triggered the response we talked about earlier, where the vaccine in some areas is only given to people who are from DC. But that's a problem. Now, this is an article that makes us think about our app, which we haven't dealt with in a couple of weeks. It's time to get back on that track, by the way. And this is a list of vaccines you need after 50, which we talk about in our app. It's interesting that some people forget about some of these vaccines that, as you see, as they're listed. And as you know, there's certain vaccines you take every year, but flu is one of them. Then there's pneumococcal vaccine for pneumonia if you're 65 or older, which is staggered, yeah. Then this one is one that you must take every 5 to 10 years, at least every 10 years. I say 5 to 10 because we get close to 10.
It's mute.
No, baby, it's not. Here's mute.
And it is especially important for people who did not go into the military. Shingles vaccine is very important if you're over 50.
Now, right? Oh, thank you.
And I think there are people on this call that have gotten the shingles, so it's not fun. Then, of course, the COVID, you're right, we have to put this on our list, which we don't have, COVID-19. We've got all the others that we don't have COVID-19.
Yeah.
And I think the Johnson & Johnson vaccine is what they're giving now at Howard. I think they've given, most of the original people got the Pfizer or the Moderna, but now they're giving the Johnson because it's only one shot. So now the hepatitis vaccine, actually all healthcare workers have to get hepatitis vaccines and the antibody tests to see if their titers are okay.
All right.
So we have to add the COVID vaccine to our list. This is the New York again, New Jersey,
Oh my gosh.
back again. Yeah. And we all were thinking, hey, we got it licked. And now, here we go again. Now, of course, it's not as bad as it was last year, which was horrible, but it's still moving back up. 62,000 cases a day. Wow.
That's unbelievable.
Yeah. And at the same time, the people are letting down their guard.
Yeah,
They're getting cocky.
it's the warm weather.
Too early.
Yeah.
Too early. That's right. They're opening restaurants and movie theaters now.
Mm-hmm.
And that's the price you're paying.
Cheryl, you got your hand up. Unmute. You want to say something, Cheryl Jones? Unmute. No, go on, Doctor.
Now, those who are thinking of traveling to New York might consider waiting a week or so till some of this is clarified. Now, this is an article because we had a lot of talk about AstraZeneca and blood count reports. And after much study, it appears that the vaccine is okay. You see that the host won't allow us to unmute ourselves. John.
Everybody's unmuted. I mean,
Flavia,
everybody unmute themselves.
Flavia.
Everybody unmute themselves. I did not mute anyone.
Well, actually, I was muted, but I was able to unmute.
Okay, Carol, try to unmute.
She said she got a message saying host would not allow it.
Okay, now try it, everybody.
Good.
Okay, yeah, now I'm unmuted.
Okay, thank you.
Okay, okay, this is true. I had a question about the Pfizer vaccine at Howard because that was my first shot. So are they keeping some on hand for the second shot? Do you know?
Of course.
Oh yeah, everybody can get the second shot. Yes.
Okay.
Just people who haven't gotten the first shot, they're giving Johnson and Johnson.
Okay.
But those who got the first shot will get the second shot.
Okay. Thank you.
With the same Pfizer, Dr. Callender?
No, Johnson.
Oh, so you can have two different vaccinations.
No.
Oh.
As I said, those people who have received the first shot will get the second shot.
Oh.
Okay, but those people who are coming for the first time will get a Johnson.
Oh, okay. Okay. Thank you.
Earl, you have your thumb up.
I was sending it to somebody. It didn't take. Okay. Oh, it went to some. It went. Thank you.
Now it's interesting because now you're talking about millions of people who received the vaccine, and if out of those millions of people you have 3, 4, or 5 who had problems, does that mean you should stop what worked for the other millions of people? That's the question. So this is why they say that AstraZeneca is now thought to be safe. Now, of course, it hasn't been approved here yet, so we have to wait to see.
They must have come out all right in that court battle.
Well, is it still going on?
Probably not.
Yes,
It is?
Yes, it is. Like you said, it's kind of deep.
you tell us a little bit about it?
No, I didn't do my homework. I just gotta pick up a few things off the internet, and it is still going on. And there's just a lot of proof that has to be proven that is in fact that is causing the blood clot. That's the concern.
Right.
Yeah.
And
You hear so many
That is-
negative things about AstraZeneca, it would make me nervous to take it.
Yeah.
I mean, you want everyone to get the vaccine, but wasn't it twice now that they've stopped AstraZeneca?
well, they never started it here, so it's not an issue.
Right.
This
I
is
know
not
they haven't done it here.
It's not approved by FDA, so they would have to be approved first. So. What's behind the rush to return to normal? Charlie, you just AMC opened 98% of its locations.
Yeah.
Gosh.
Yeah.
I didn't know that.
I want
It's
to go
amazing.
Senior Moments. Senior Moments is out. I want to go see that.
I want to see nobody.
Very true.
Oh, Lord.
Then they,
Oh.
well, there's no question that a year of isolation is a bit much. So people can't wait. Of course, what happened in Miami is awful, but anyway. And you talk about the depression that has reached epidemic and pandemic proportions, with suicide rate doubling in African Americans and obesity accelerating rather than decelerating. All of those things are the reason why people can't wait to return to what they call normal. And I think one of the things that will occur when we get to normal is that the mental health experts will be overwhelmed, as Flavia had mentioned earlier. That's the
Dr.
next.
Callender,
Yes.
I sent an email. I forwarded an email from AARP at 1 o'clock today. They're having a town hall about coronavirus and the African American community. So, and one of my friends, in fact, the head of the APA, American Psychological Association, he's an African American, someone that I know is going to be part of that. So, and it's free, it's at 1 o'clock. So check your email, and it should be really good.
There's also been a tremendous increase in drug use as well. Substance abuse has gone up tremendously in the Black community during COVID, and a lot of overdoses are occurring, which also has implications for future transplants. I mean, there's the alcoholism as well as illicit and prescription drug use is in our community.
This is the article that talks about the animals being the source of, and of course they had said earlier it was the bat, but actually which animal still remains to be seen, although the bat is thought to be the likely animal. I think the World Health Organization is trying to research it even further. Although I'm not sure it matters, but
there's a lot of kickback about this report too.
Yeah.
The next article talks about it.
It's interesting because you think about all the trillions of dollars that the United States has had to put out as a consequence of this virus. Yeah, this is the report you're talking about. They're infuriated by it because they felt it's an anti-Asian effort. It may well be. They thought it was irresponsible to prematurely leak information like this.
Dr. Callen, I heard a rumor that in China, they handle bats a different way than they do in other countries, but I haven't heard that they actually eat them.
Well, it depends, because there's probably not that many people who do it, but, just like in Africa, everybody doesn't eat the apes, but some people do. And that small amount of people can be the source of the infection. Yeah, it's interesting how Trump was really infuriated by it. I felt they were protecting China. And of course, China is one of the richest and most powerful countries in the world, certainly the most populated. China and India make up 2/3 of the world's population.
That's right.
It's interesting how we talk about white supremacy and whites are actually a minority, but but we sometimes forget that.
Yeah, the numbers are white European type of Caucasians make up about 7% of the world's population, and it's about equally split between Europe and the United States.
Wow.
Which leads me to believe they must be pretty smart to dominate a world where they're in the minority.
Not really, because when you look at what they call age of imperialism, that started 1400, and that's when colonialism started in the world. And so that's only just a brief instant when you look at the last 600 years to world history. There has been no dominance of white civilization prior to the year 1400. The primary civilizations before 1400 were all people of color. And a lot of the royalty in Europe before 1400 were black royalty. So there was a couple of fortuitous events that led to imperialism, and that's the rise of guns. White people would not be where they are today without guns. And then secondly, cure for malaria in around 1900 allowed them to invade Africa. But before that, Africa was known as white man's graveyard. But it's just got a couple of recent developments: guns and cure for malaria that aided the white man's rise. Because the United States would be nothing if it weren't for slavery.
Yeah, that's true.
There's a book called Guns, Germs, and I forgot the third part of it, and it talks about just what Daryl was talking about, because that's what made the difference: the ability to domesticate animals, and also the germs that they used, no offense, to kill the Native Americans, among others. And the guns, of course, made the difference.
And sugar.
Good old sugar
was another one that killed us off. Yeah.
every dog has their day. White folks are just a dog having their day. Let's say the sun.
Well, that to me, white folks are no different from other people. They're just as evil as everybody else. They're not any more evil than anybody else, is my opinion.
So that means they'll never repeal the rifle control in Congress, because that's what made America come to power, the guns, the weapons. So they're just spinning wheels when they're trying to repeal, you know, with all these guns controls and all that kind of stuff.